and welcome to our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we're getting ready for our GOLD Midwifery Online Conference of 2021. And I have the great pleasure of sitting down here with a very special guest, one of our speakers. And here with me today is Professor Emeritus Jenny Gamble. Welcome.
Thanks very much. It's a real pleasure to be with you today.
Oh, it is lovely to have you here. And I know we want to jump right in and talk about the presentation that you will be having here with us at the Gold Midwifery Conference. But before we do so, where in the world are you located?
I'm in sunny Brisbane in Queensland in Australia. It's subtropical and it's absolutely gorgeous weather at the moment.
I can tell you're sitting there in a beautiful sundress. So for you, it is summer in February, right?
Yep, that's right.
That's absolutely fantastic. I am so excited to have you here with me today because you will be talking about the fear in childbirth. And before we jump in there, give us a little background information about your professional journey.
Yeah, thanks very much. I've had a fantastic career as a midwife, and I really became a midwife because I was working on a remote area community, an Aboriginal community here in Australia, and that really inspired me to become a midwife. And my whole career has been an amazing journey. But for 10 years of that journey, I set up and ran a private midwifery practice. We call them independent midwives in Australia or self-employed midwives. And what really drove me to that was that I just didn't feel that women were getting the sort of care that they really needed. That was an amazing time. And then subsequently, of course, I've had an academic career. So I did my PhD in perinatal mental health, really looking at women who'd experienced a traumatic childbirth. Then we went on to do the work around fear of childbirth. And of course, the two things are very much related, as you'll hear in the presentation. So for me now, as a Professor Emeritus at Griffith University, I'm also Director of the Transforming Maternity Care Collaborative, and we're really trying to drive that notion of quality maternal and newborn care through our research, but also through our professional influence and our work with health services.
Wonderful. What a wonderful career you have there, and the amazing work you're doing in your country and in your community. It's wonderful to hear. Absolutely wonderful. You will be talking about the fear in childbirth. And what I'm excited about is in recent years, the topic of trauma in childbirth has become finally talked about. We learn more and more about the topic, and it is absolutely incredible, the research that is coming out on this, and also about the fear in childbirth. And for many years, and you probably know this much better than me, it was not talked about. It was considered something like, oh, well, every woman has to go through childbirth. Everybody is, a little bit afraid, but that's what you have to do. Even care providers were not very empathetic about it. So tell me a little bit about what your experience is with that and how you got into the topic of fear in childbirth.
Yeah, thanks very much. I think it is a good thing that we're talking more about both traumatic childbirth and fear of childbirth and coming to an understanding that it's not okay. And we'll talk more about that in the presentation. But I also think that it's quite important to situate this in relation to, I guess, what you alluded to, the normal anxieties of any major physiological and social life change versus disruptive, disabling fear of birth or traumatic childbirth. What I think is also pleasing is to see that notion of fear of birth, traumatic childbirth, linking up now with that movement to humanize childbirth. And I think a growing understanding of the system contributors to both dehumanize childbirth and to the notion of fear and trauma around childbirth. So really starting to not just look at women in terms of dealing with their struggles and challenges with fear of childbirth or traumatic childbirth, but starting to be a bit more reflective about what our role is as a health system as well as health practitioners. I think that's all a very interesting movement and overdue.
Yeah, absolutely. Yeah. And our role as healthcare providers in this, right? I mean, we play such an important role in this very important journey of that a family is taking, and there's so much we can do better. I see that even in my practice. I've seen that, I've become, through the research, what I've learned, even more and more aware of the traumas, of the fears that are there and can be very debilitating. I recently had, even a friend of mine that I was not aware of had a very traumatic childbirth, and she is expecting another baby, and she's going for a cesarean section because she said, I can never do this ever again. I want to be knocked out, not see anything, not hear anything, just give me my baby. That's all I want. And we see this now, and this is quite something. So we have to do better. We have to do more and learn more about this topic.
Hmm. Yeah, I think that's an interesting point that you make, and I'll talk about that first. That notion of choosing a cesarean section because you are so fearful or have had a previous traumatic birth experience. In fact, I did that for my master's research, and I asked women what their preferred type of birth was, and gave them multiple categories, and cesarean with GA, cesarean with epidural, really about 8 different options, and also asked them their motivating reasons. And the standout feature of that study, which I think is still the only study in the world that has a representative sample of women using the public sector and the
Uh-huh.
private obstetric sector, was that most women overwhelmingly want to give birth normally. They want to have a normal, spontaneous
Mhm.
vaginal birth, but they have had such poor experiences or been so frightened by the stories of others, often people very close to them, that uh, they just so I don't want to use the word choose or even decide. It's almost
Mhm.
like a response to circumstances. It's the
Right.
only way they
Mhm.
feel that they can regain some sense
Exactly.
of control, and
Right.
they're too fearful to risk the other. And
Right.
the other isn't a healthy vaginal birth with a good experience. They're scared of all the other options: forceps, vacuum, potentially emergency cesarean section. And the other big reason is because their doctor recommended it. And again, how much of that's a choice, really,
Right.
if you're being asked to do that route. And the other women, of course, were women who had a previous cesarean section, often by an emergency procedure. So it's complicated, isn't it?
Yeah,
If
it's
we
so
just see it,
complicated.
if we see it in just simple choice terms without understanding context, then
Mhm.
I think we're missing a big part of the picture. But in fact, I went into private practice after working as a clinician, as a midwife in the hospital sector, because I was running an antenatal class, and I had a young woman in that class who was just 16, and she was there by herself. And I said to her, "Oh, who's coming with you?" After she's sort of hesitated and stayed back a little bit at the end of the class, and I think she might have asked me, "Is my baby growing okay?" So I said, "Look, if you're comfy, I'll just feel your tummy now, and we'll have a little talk." And everything was fine. And so I asked her who was coming with her for labor and birth, and she said no one.
Oh,
So
oh my
so
gosh.
that's really started my whole journey of providing care in a continuity basis. And I still get Christmas cards and photos of that baby who's a
Oh.
fully grown up person uh, every year. So
Oh,
yeah. Yeah,
yeah,
yeah. I think it's quite, we've got such a powerful position to
yeah,
influence and impact on the the whole health and well-being of the woman and the baby and her family. It's
yeah.
a real privilege.
It is a privilege. It is a privilege and something that, yeah, and a joy, and of course, a heavy responsibility too, because we want to do the best for our families and our clients. And the factor of fear is so complicated too. Fear, we don't know where this fear, as you mentioned, where it's coming from. Is it because of a traumatic previous birth? Is it because of other, sexual violence or abuse, or just other things that we have absolutely no idea about, or sometimes even that the woman don't even know why she has that fear, right? So what can we do in these kind of cases?
Yeah. I think when you're providing very fragmented care,
Hmm.
very tight appointment-based care,
Hmm.
very institutionalized care that is rigidly controlled by guidelines and procedures, then it's very difficult to really have the opportunity to talk with women in a fuller way
Yeah.
about what's really going on for them.
Absolutely. Absolutely. Before I let you go, um, what little nugget of wisdom can you leave with us today when it comes to this topic? I know it's complex. I know we could talk for hours, but if you had to just give one little advice to somebody listening and is interested in the topic right now, what would that be?
I'm going to give two.
Oh,
One is one is to really think about your relationship with the woman and ask questions
hmm
that make her feel safe
hmm
and that you are trustworthy for her to share with you how she's really feeling. Open questions, exploratory questions, sometimes probing questions. Oh, why do you think like that? How do you really feel about that? What does that mean to you? Help her explore where she is emotionally and put it into words. And then the other thing I would say is we really have to tackle the system drivers
hmm
that contribute, cultural and system drivers that contribute to women being frightened to give birth, especially in countries where it is incredibly safe to give birth.
Yeah.
So the fear is out of proportion with the risk.
Well, Jenny Gamble, thank you so much for sitting down here with me today and talking about this very important topic here. And I can't wait for your presentation here at Gold. Thank you so much.
It's a pleasure. Thank you very much.
And for our viewers now, the presentation Assessment and Management of Fear in Childbirth will be part of the GOLD Midwifery Online Conference of 2021. The presentation will be live on February 10th. And to know when that is in your time zone, please visit goldmidwifery.com. You'll find more information on this presentation and all the other presentations of the conference. Thank you everyone for watching. Bye-bye for now.